Mental Health Festival 22. My name is Mark Kawakami, and I will be your humble moderator this evening. Full disclosure, I am a lawyer by training, and I suspect that the organizers have asked me to moderate this event because lawyers are typically good at giving people bad news. To say that we are crawling through a turbulent period of uncertainty and a relentless cascade of stress-inducing events somehow feels like an understatement this year. The US election, riots in Italy, attacks in Vienna, and of course the COVID-19 global pandemic has made us feel vulnerable, isolated, and scared. But the noble aim of this event and this festival in general is not to dwell on these lingering causes of worry, but for us to find constructive and meaningful ways to connect, to educate, and to help one another stay afloat during this storm with our sanity and mental health intact. Before I introduce you to our speakers for tonight, I would like to encourage you to ask questions using the Q&A function on Zoom, and I'll read them out to our speakers during the panel session, which will follow the keynote. So please submit your questions or vote for the questions that you would like to be asked, and I'll pose them to our speakers to the extent that time permits. Keynotes are expected to speak about 30 minutes, followed by 30 minutes of panel discussions, give or take, plus some concluding thoughts at the end. All in all, we hope that this will be a fruitful event, wrapped up by 8:30 Central European Time, absolutely at the latest, in time for the start of tonight's Champions League football matches, if you are into that. One of the most difficult tasks demanded of a moderator is chopping up the speaker's lengthy accolades down to a mere sentence or two without causing insult or offense. We have some truly wonderful speakers, and I ask for their understanding and mercy in advance as I truncate your glorious CVs for the sake of focusing our event on the substantive matters and our audience members are here for. I see Peter having a glass of wine. Please, everyone, feel free to BYOB. It wouldn't be a festival without it. I have mine. But without further ado, our first speaker is Misha Seles. She is a psychiatrist at Mondrian. As a matter of fact, I am the only non-psychiatrist who will be speaking tonight. Misha is also a mindfulness trainer, and perhaps most relevant to our event, she is the program director for the International Mental Health Festival, and she will give us an overview of the festival and the organization behind it, Oh My Mood. And so, Misha, can I pass the Zoom over to you?
Marek, I am really impressed. You sound like a psychiatrist. So now maybe you ask for me to talk like a lawyer. My name is Misha Seles, and I'm one of the psychiatrists, and I'm also the program director of the International Mental Health Festival, which I'm really proud of, with all the people working behind the scenes. Actually, I stopped working at Mondrian and started working as a psychiatrist for Oh My Mood. This is my first job for the foundation. And I think I really love what Oh My Mood is doing. We think that knowledge about mental health should not be only be in healthcare, but it should be widely accessible for all people. We think that awareness about mental health is a source of transformation for our own health and for the society we are building together. I'm originally from Maastricht also, and I'm really proud it's the city that hosts the first evening. Due to Corona, unfortunately, we cannot meet up in person, but we will try that next year again. But the positive influence of Corona is that we can go global easily. So I'm really proud we have 4 continents and more than 30 countries contributing. Mark, really nice to meet you, because you're also from University of Maastricht, maybe not originally, but it's my hometown. And my friend Therese, we've known each other for some time and we work as colleagues. So I'm really glad Maastricht is present today. Professor Christoph Correll from Charité, really welcome. Actually, Charité is my favorite hospital in the world. I was a patient there. I donated my kidney to my sister 3 years ago in Charité, and I was really impressed by the hospital and the healthcare in Germany. It's also good to look across boundaries. Maastricht is an international city, so that's a connection we already have. Then we have Marco Solmi from Italy, which is a country I really like to go on holidays. It's a little bit difficult now, but really glad it's a really European and international event. I saw another interesting study from Marco at LinkedIn, where there was a big study that people who had heart surgery had improved mental health. So there is more and more awareness of the link between body and mind well-being and wellness. And then we have Professor Peter Kinderman from Liverpool, and I'm a huge, I met you on Twitter, social media makes connections come close, and I'm really a fan of your work, making, not medicalizing all the complaints and symptoms we see. How we have a group of patients with psychiatric illnesses, but healthcare is crowded with people with psychiatric and psychic mental health complaints and symptoms without having a disorder that needs to be treated by a psychiatrist. So welcome, and let's have a start with the COVID study. I'm really impressed. I read it had 100,000 participants in 30 countries, and a 3-part study to study the effect of COVID on our well-being, mental health. And I think actually that's what everybody is talking about, and everybody has all the opinions. And I know it's not something we have all the results now from, but I'm really glad to have a discussion with experts who actually examine the effect of COVID on our mental health. So now I give to my friend, the lawyer and moderator. I'll give it back to you so you can start the discussion.
Thank you, Misha. Okay, I've already learned 2 things from your opening, which is 1, the importance of updated information. That the fact that don't just look at what's on the internet, actually do the research, look at the facts. And I think one of the things that inciting Marco's study about suffering hardship somehow makes us more resilient. It makes us tougher, is I hope just as heart surgery patients come out from the surgery stronger and more resilient, I hope we come out of this pandemic stronger. But with that in mind, yes, I would like to introduce our keynotes. It's hard to say above and beyond what Misha has already said, but our first keynote is Dr. Christoph Correll, who is a professor of child adolescent psychiatry at Charité Universität Medicine in Berlin. Again, a peer recommendation, great hospital. And again, I could spend the full hour and a half on just mentioning his accolades, but I'll choose one by noting that he is one of the most influential minds, scientific minds, and one of the most cited scientists in the area of psychiatry. And our second keynote, of course, is Dr. Marco Solmi, who is a psychiatrist and an assistant professor at University of Padua in Italy. although I've heard that he does spend some time at the EPIC lab in King's College in the UK. And together they are the lead clinical researchers of COH-FIT, which stands for the Collaborative Outcome Study on Health and Functioning During Infection Times, COH-FIT. As Misha said, it's an international survey project, over 200 investigators, 100,000 participants across 30 countries, 6 continents, and this is the most impressive part for me, 25 languages. That's almost biblical, and I can't imagine how the process behind it. But it is a longitudinal study, which started in April 2020, where survey inputs are solicited online anonymously in 3 different periods. Once during the pandemic, again, 6 months after the pandemic, whenever that will be, and lastly, 1 year after the pandemic, which means that what we will be sharing today for this event will mostly be on how people are dealing or coping with COVID-19 now during the pandemic, paying particular attention to issues of physical and mental health problems, identifying those at higher risks of such problems, and various prevention and intervention measures. So without further ado, Professor Correll and Dr. Solmi, may I kindly invite you on to Zoom for your keynote, please.
Great, thanks very much, Mark and Misha and everyone else for giving us actually the opportunity to talk today during this very important event of an international mental health organization. So keeping mental health in the focus is so important because there's no physical health without mental health, but there's also no mental health without physical health. And both Marco and I have been focusing a lot of our research activities on exactly this interface, how to improve both and not leave one behind. Now, today we'll be talking about a study that's very dear to our heart. It's the COH-FIT study. We want to have people be fit during the COVID pandemic. COH-FIT, so www.cohfit with or without a hyphen.com would be how you get on it, and we'll say this website a couple of times today. But we want to talk to you a little bit about what it is and what we've already found. It's still ongoing, obviously. And before I ask Marco to chime in, again, there are updates on the website. It's 30 countries, but it's actually the 200 investigators from 30 countries. We have now answers from over 107,000 people from 146 countries. So that's a little bit more. And basically, we'll talk a little bit about how this is going about. So maybe, Marco, you can talk, how did it all start?
Yeah, thank you, Christoph, and hi to everybody, and thank you for the opportunity to share something about this COVID study in this important international festival. So how did it all start? I remember it was early April, and I was stuck at home basically because there was the lockdown due to the COVID pandemic in my region in Italy. And let me tell you, it was not an easy time. It was not so, kind of usual for me and also my family, and also from the professional standpoint and also the personal standpoint, homeschooling little girls and at the same time having to be productive and work. So I kind of shared, I think, what everybody was experiencing in that time. And as a researcher, I thought that, well, we could do something to measure what is happening. So I might not be the only one being affected by the situation. And so I was having a call with Professor Correll for another project, and we actually kind of happened to talk about the possibility to develop a study exactly measuring how people are doing. And that's how it all started. And since then, in very few weeks, we have been so lucky to build a team with so many world-class scientists across the world, starting from Europe and also from other continents, day by day, sending emails and building up a team with people and friends and colleagues that we basically trust from a personal and also professional standpoint. In this way, we have been able to set up the main questionnaire, send around all the questions, having people contributing, commenting, improving the whole structure of the questionnaire, And then ultimately, when we got to a final version, it has been translated. Now it has been translated in 31 languages. It's been now translated in a South African dialect. And I think this is also very important because, Christoph, you might tell a little bit about this in a few minutes, but I think it's also important for the inclusivity of the project. Many projects are currently running. We didn't have, I mean, of course, we are not the only ones that have had the idea to run such a study, but the one peculiar feature of the COVID study is, of course, the inclusivity, because it's not leaving anyone behind. You might live in the UK, you might live in the Netherlands, you might live in Italy, but you might not speak English, you might not speak Dutch, or you might not speak Italian. So having the survey available in 31 languages is very important. The big picture of the study was actually to try to measure some predisposing factors, which might be modifiable or non-modifiable, and then measure some outcomes. We have been structuring the survey asking how people are feeling right now, or how they have been feeling 2 weeks before the pandemic. And we have been identifying, as I said, non-modifiable risk factors such as gender or age or having a chronic condition, and modifiable risk factors, which might actually be those that we could think about targeting. Because, for instance, if we see that resilience is something that turns out to be protective against poor mental health, it might be a target. It might be worth to give it a try as a target on the general population, or at least in subgroups of the population at increased risk of poor mental and physical health. So, Christoph, why don't you share a little bit about the outcomes of the COVID study?
Yeah, before going there, I just want to go back briefly about differentiating COVID, because people have a little bit of survey fatigue, and many of the listeners might say, well, why another survey? And so just actually it started by our looking at, we were invited to participate in a survey. It was on basically being locked down and isolation and loneliness. And we looked at a couple of surveys and felt, yeah, all great, but very narrow, either the topic or the population. And we wanted to go much broader. Now, the narrow surveys obviously are shorter and can use all these validated large survey questionnaires. And we took a different tack. We actually said, we want to know much more about a lot of psychiatric symptoms that may be subthreshold or getting worse in the general population. This is for everyone, everywhere. So nobody, it's an anonymous survey, everybody can participate. We're interested in subgroups, migrants, pregnant women, frontline healthcare workers, older people, kids. We also do this in 6 to 13-year-olds with a shorter survey, about 15 to 20 minutes, and then 14 to 17-year-olds, a similar survey as for adults. And so we said, we want to go really deep and broad, but we can't overburden people with too long a survey, which takes about 35 minutes in adults and adolescents. So what we did, we actually took 1 or 2 items out of validated scales and said, these are, based on our experience, the ones that cover depression. So even you might have 12 items to ask about depression and sleep and appetite, and whether you like to do things and whether you are ambivalent with your decision making. We felt 2 questions would cover depression. And we took them out, and we actually asked 10,000, 15,000 of the people to not only answer our short questions, but the whole questionnaire, and found, lo and behold, and that's what we're writing up right now, that yes, we can use these short questions to capture the dimension for almost all of them. And we want to construct a so-called P outcome, which is the psychopathology. How do you feel in your psyche based on very different elements? But as Marco asked me to talk about the beginning results, I was very intrigued during this first validation project that we also asked, how do you feel about your mental health and how do you feel about your physical health in general? And it's quite comforting that people seem to be very good computers of who they feel and who they are, how they feel and who they are. Because this one question, and how did you feel before and after, really captured when we added together a lot of the subdimensions. So this one question, and that's, I think, a big important outcome here, that one question might already be pretty important, and that's a question we should ask ourselves. It's a question we can ask our friends and family members and co-workers, that they just give us a temperature, a pulse. How did you feel before and now? And then you can go into more depth. Why do you actually feel sad or what have you? So I think that that's something that's important to note, that we're going quite broad and deep, and we're including so many countries, and also children and adolescents. So please participate and send on the link, because we need more people to look at these subgroups. Before I toss the ball back to Marco for more results, just want to say something about the longitudinal aspect you mentioned. It's 3 separate cross-sectional assessments, because we didn't want to have one cohort that you follow the whole time, because it gets less and less and less and less. But since now the pandemic, unfortunately, is continuing for so long, it gives us an opportunity to, within the pandemic time, to make the cross-sectional assessment a longitudinal one, because we have different individuals that are answering at different times of the pandemic. Either it's bad or it's getting a little better, schools are closed or not, and we can ask this in the survey, whether schools are closed and whether they are in quarantine. But we also know from the Johns Hopkins website what the replication factor is, the level of mortality rate, and can also look at that, how basically the population in Italy, in Germany, in Uganda, where they actually do now phone interviews for us, how that changes over time. And I think that's another big strength of this study. But having outlined a little bit more of how we do it, maybe Marco, you can go into some of the results.
Yes, thank you, Christoph. So I will tell you a little bit about the results, but first let me give you another framework which is important. Who are these results representative for? I mean, even if we find a prevalence or let's say a worsening of depressive symptoms of 50% in the whole population, we can't make any inference on the general population, because of course the snowball recruiting sampling that we have been operating over the last months starts from a pretty high educated strata of the population, and it might not actually be representative of other strata of the population. And so in order to account for this bias, which is a selection bias that we have since day one of the study, we have been collecting also representative samples, which we will use then to weight the results from the non-representative responses. So in this way, we will not be able, of course, to adjust completely all the biases operating but biases are everywhere in any study, but we will still be able to weight the results accounting for the strata representative strata quota of the general population. And in this way, we can make some inference on the general population. So again, you mentioned bad news, good news. I have some bad news, but I also have some good news, actually, to be honest. So I will start with the bad news and then with the good news. I think it's a good approach. So of course, we are all witnessing and experiencing this stress has increased across all the strata of the population. No matter where you are living, we have been running some preliminary analysis across all the languages and many countries, and results are consistent across all the countries. Stress has increased no matter the age group and no matter whether you are a female or a male. What we have found also is that some groups are specifically at increased risk of some poor mental health proxy outcomes. And these are, of course, loneliness and anger. To be honest, I expected to see loneliness doing way worse in the elderly, because in my mind, elderly people have been isolated, of course, in order to protect them. The nephews or the family members did not go to visit them anymore because they didn't want to bring the infection to their home. But what we found actually was that loneliness, which is the experiencing of being isolated and lonely, is actually worse in the youngest rate of the population. And maybe it was my fault, but I was not expecting this, honestly. And also anger was the same. Again, it has worsened way more in the younger strata of the population. What does it mean? Well, actually, it could explain at least some of the behaviors that we have been witnessing, like from those strata of the population, from the younger people who might not be so compliant to some restrictions and some, indications of the government. And it actually might just be a proxy of a difficulty in being able to cope with the pandemic, which might have, very badly affected also their daily routine. One more category that is at increased risk of these mental health proxy outcomes are women. The vast majority, 2/3 of the responses came from women. And women have also been those with poorer mental health proxy scores. So again, if a government wants to make prevention and promote mental health during lockdown and future infection times, or during this infection time, women should be, of course, targeted for prevention. And let's now move to the good news. I don't know, Christoph, if you want.
Yeah, maybe I can say something before you go to what helps people to cope, because coping strategies are important, and who hasn't used them, we want to reinforce that. So first of all, I mean, we're not sure why women are more affected by the stress and also the mental health aspect. And we think, they could be more honest than men. They're actually more reaching out to actually talk about their feelings and take the survey. But also in sub-analyses in Austria, where they drilled down a little deeper already, they found that it was particularly women who had to be multitasking even more. They had to do job, but also had the kids at home, do home tutoring, and multiple roles, and men might be able to just segregate their roles a little bit better, and women are juggling everything, making it even harder for them. And then the younger folks, why they felt more lonely, I think elderly people are more used to being alone. That's part of their role, whereas the youngsters are so, wow, where's my party, where are my friends? And if they don't have that anymore, they feel very restricted. They also want to test out maybe relationships, and when that's not possible anymore, they're locked back down at home. That's maybe more, it's harder for them to take. But maybe, Marco, you can talk about some of the coping strategies that were quite fascinating to see, that are helpful, and that will also send a message to the audience that if you're not doing these things, that seems to help across cultures and across age groups.
Yes, of course. So again, this has been consistently found across all the strata of the population and across all the countries. The two coping strategies that people felt to be the most helpful for them have been exercising, so physical activity, not only exercising, but also walking, and so light physical activity, and of course, being in direct contact, so in direct contact with people, not via a video.
But also via video. I think that was reaching out to people, being connected, that was crucial.
Also that one, but as a first, to a higher rank, the real personal interactions. But of course, this one cannot be, of course, the way to go during the pandemic. So we have two main strategies left, I think. Interacting with people and social networking, even again, via video and via all the tele devices that now have become part of the life of all of us. And it was not maybe the case before the pandemic, but also exercising and going out for walking. I think if it's allowed, that's something that we should all do, of course. If we can't go out of home because the restrictions are very, very, very tight and very, because the pandemic is very, very bad in that region, there's still something that we can do in our home place. Of course, we can reduce the sedentary behavior that we have. We can walk while we are talking on the phone. We can set up a working station that allows us to stand instead of working while we are sitting. We can, modify the structure of the living room of other rooms in order to, to put something that forces us to keep standing and to move. Also, reducing sedentary behavior might definitely be of help. It improves mood, it improves health, it improves anxiety, and it also improves physical health, of course.
Also, walking outside was helpful to people if they can walk. So I think not closing down parks might be relevant for the government. Marco and I actually worked on a grant where we wanted to provide information from COH-FIT, but also other sources to give evidence-based governance. Unfortunately, we didn't get the grant, but I think we should all work towards gathering information to improve physical and mental health. And it was interesting that I think contact any way or shape or form was relevant. And imagine not having the internet or social media, it would be much harder to stay connected and not feel lonely in this day and time. It seemed that women were a little bit more taking pleasure out of direct contacts, whereas men not so much. Or a little bit less, I wouldn't say not so much. And also working from home when it wasn't adding extra stress was also helping people, either from home or outside. So doing something meaningful with your time. So that's also important. That gives us self-esteem. We don't fall into like a loophole. In that sense, I think we can learn from that. Now, the governmental satisfaction with governments ranged enormously. So the worst rating was actually in the UK, with 17% of people being happy. I think if I remember that correctly. Then Turkey was 44%, Switzerland around 50 or so, or 60. And then the highest satisfaction was actually at that time, and I think Italy also around 60. But then the highest satisfaction was in Germany with almost 65 and 70%, and Australia, because they've been able to actually lock down things. But they haven't participated much in the survey either. I mean, Italy is leading with over 10,000, then we have 8,000 participants in Germany, and in Hungary, 7,000 in Greece, but less than 600 currently in Australia. So Canada, only 200. So we still have a couple, India, 600-700. We have a couple of countries where we still need to get much more information before we do the first data cut, which we expect toward the end of the year, to then really drill down into many more of the findings and then actually publish them also. So maybe we can turn it over to see whether there are questions from the other speakers or the panel, or even from the audience, to go a little bit deeper into this.
Thank you, Christoph and Marco. Very interesting findings on so many different areas. Again, this will be a good reminder to the audience members who are tuning in to post your questions through the Q&A function. If I'm going to abuse my position as a moderator to ask a very short yes or no question to the two keynote speakers, you said exercise and contact, whether even if it's online, is a good coping mechanism. Now, my friends and I have a theory that drinking is also a third possible coping mechanism. And I was wondering if you can sort of validate or sort of say that's incorrect, drinking is a horrible thing, because I see Professor Kinderman and I drinking from our cups. I think that's a coping mechanism, but if you could sort of say yes or no, drinking as a coping mechanism, yes or no?
Yes, water, tea, coffee, juice, but alcohol, I mean, it's a big problem. People have less access now to drugs where you need to have a dealer or something. So alcohol has actually increased. And yes, one glass, or stay within the limits, half a glass for females and not when you're pregnant, might be a little bit relaxing, but alcohol is quite dangerous to your mind and to your body. And it's certainly not a functional coping mechanism. It can be a coping mechanism that in the short run gives you a little bit more of a relaxation. But if you feel anxious, use other strategies, go for a walk, call a friend, do a hobby, do exercise. But really drinking per se to deal with mental health issues is not a good idea, and not more than really what makes sense, which is a glass of wine maybe, but not more. But Marco, what do you think? You're in Italy, so maybe drinking is more acceptable, but from a mental and physical health
not only in Italy. Not only in Italy. I'm in Veneto region, which is you know, the land of Prosecco and many other very, very good wines. By the way, I took a close look at the data for a preliminary analysis for my personal interest, and we actually found also in Italy that a substance widely meant, including alcohol or other substances, is not actually one of the most frequently top priority coping mechanisms, according to what people responded to the survey. To be honest, I might have been also expecting it a little bit higher in terms of ranking, but it's not so frequently reported as a very, very important coping mechanism. We also took again a preliminary look at some data in terms of also substance use, and we actually found that alcohol use has decreased since the pandemic started, and also other substances such as cannabis, for instance, has decreased. Does not be a huge change, but the direction of the change has been in terms of decreasing. Whether on the other mental health outcomes, it has been increasing, which means it was getting worse for the other outcomes, it was getting better, so less use for other substances. So I think that people with dependence and addiction disorders, of course, they might have been got into trouble because of abstinence or craving and maybe some behavioral related symptoms. But most of people, I think they just use less alcohol, and ultimately this is not too bad.
I think we also need to adjust this for the representative samples. We haven't done that enough yet because we have a higher socioeconomic status. And that brings me also to one point. There are also winners, our partial winners of the COVID-19 pandemic. Although maybe a group of at least 1 out of 4 people will have a worsening of stress, maybe 1 out of 7 has an improvement of stress. And those might be the people who otherwise were traveling a lot, away from home. And if they have a good family structure that is not too much under pressure, are not economically at risk of losing their livelihood, they actually, some of them enjoyed being more home and having good family interactions and times, and they could even buffer the homeschooling and had more interaction and quality time. But we're also concerned about the other people where they just made it work and also needed outside structures to help with children and maybe also getting away from a very stressful home environment. And we're very concerned that people might now actually get more into domestic violence, even child abuse. We've had more and more of these cases now in the emergency room. And now that the pandemic is coming back again, and maybe with a stronger wave, and there's still the uncertainty how long it will last. Uncertainty may be harder to tolerate than, okay, I hold out until June and then everything will be fine. We're worried that things get worse. We also see more eating disorder patients, adolescents that come with anorexia nervosa because they're just home and can follow their own routine of not eating. Family members are maybe absorbed with other things. So we're quite concerned about some people not doing so well. And even those that I've talked to that felt they were more of the winners and had benefits from it, that gets eroded now too, because it's lasting so long. So even people who have taken the survey, www.COH-FIT.com, they can take it again because it will have now another impact on them and another time point of the pandemic.
Thank you for indulging me. I guess I'm the outlier when it comes to certain things. But again, pandemic is an accelerant. If you were already experiencing some sort of issues or problems, it seems to exacerbate the situation. But now I would like to sort of invite our 2 panelists for the evening. The first, Professor Therese van Amelsvoort, who is, again, a psychiatrist, and as already noted by Misha, a colleague of mine at the beautiful city of Maastricht. She specializes in intellectual disabilities, psychosis, neuroimaging, neurochemistry, and a bunch of other cool stuff. And also Professor Peter Kinderman, who is the head of Institute of Psychology, Health and Society at the University of Liverpool, go Reds. and Professor of Clinical Psychology, who also serves as a consultant clinical psychologist with Mercy Care NHS Trust. So without further ado, I would like to invite Professor Kinderman first. If you could sort of give us your comments, your opinion with regards to the keynote presentation.
Thank you very much, Mark. Yeah, so excellent. I thought it was really, really interesting. And don't take this the wrong way, but it was more interesting as a cross-sectional survey than I thought it would be. There's a lot of detail in the data. There are a lot of relationships. There are a lot of findings that need to be drilled into in greater detail. Incidentally, I'm not drinking alcohol in order to deal with mental health problems. I'm drinking alcohol because I like drinking alcohol. There's a huge difference between those two states, and we need to be clear about that. So, I mean, the key things that I took from it were loneliness increasing worryingly, but also anger increasing. And I think the focus on anger was really interesting to me. We can see anxiety because there's a deadly pandemic. We can see frustration, stress in more general terms. We can see low mood. We can see hopelessness. Anger, I think, is really interesting. And I'd like to see more attention to that because it's a fascinating subject. I'm interested in the politics of that, to be honest, whether people are angry at the virus. I suspect not. I suspect most people are not frustrated at the process of the disease itself. I suspect people are angry at our politicians. And you know, I live in a country where our politicians are corrupt and stupid and incompetent and evil, and it depresses me. They're giving huge contracts to their friends and colleagues. They're not taking decisions in a timely manner. They're not listening to the medical science. It's depressing, and I use that term advisedly, but you're absolutely right. It's infuriatingly angry to be in this situation. So I'd like more attention on anger. I think the gender issues are interesting. I think the idea that women, as always, are picking up the tab because they're doing multiple roles, and that we as men are possibly allowing that to happen. So at times of crisis, civilians suffer. At times of crisis, the poor suffer, the vulnerable suffer. And at times of crisis here, perhaps we see women bearing the brunt of the demands on society. And I think that's an interesting finding. I like the focus on the coping strategies of exercise and contact. I would draw people to something called the 5 Ways to Wellbeing. That's just a kind of survey of those things that we can do ourselves in order to maintain our mental health. And in the UK, Public Health England and some of the mental health charities and professional bodies have been focusing on not only what we can do to support people, but what individuals can do themselves to support their mental health. And the 5 Ways to Wellbeing, where exercise and relationships are key elements, are important because we can do things about that. We can't do much about the virus, but we can take steps every day to improve our exercise and to remain in contact with people that we love. So I think all of those were absolutely fascinating things and issues that tell us more about the mental health response to the pandemic than just it's a bad thing. The one area where I'd really like to see more work is, like I say, on anger. And you know, as a psychologist who's interested in the social determinants of mental health, I think there's possibly more work to be done on what it's like to be living in countries where our politicians have let us down. So fascinating, and thank you for sharing.
Thank you, Professor Kinderman. Can I invite Professor van Amelsvoort to sort of continue?
Unmute, yes. Thank you, Mark, and thank you, Christoph and Marco, for sharing the first results. And I am also the Dutch coordinator of the Dutch branch of the COVID study. So I've been involved in the more tedious parts of IRB approval and translating issues. So it's really nice to see that it has paid off and hear some of the first results. To comment on some of the results, I really interesting that the gender issue also, which doesn't really surprise me, but I'm interested to see how that might shift when we include younger people, and whether in the younger categories we might see more boys that are dealing with more problematic mental health issues. So I gather the results that you've been presenting today is mainly the adults and not yet the younger ones. And yes, so that would be, I would be very interested in that. And then also the age, I wasn't surprised to hear about more loneliness in young people. Myself, I'm focusing on youth mental health, and we have this Dutch version of the youth mental health initiatives like Headspace in Australia. And we started the chat actually for young people during this pandemic. And it really exploded. And it's particularly painful to see what sensitive issues young people coming with that with a lot of loneliness, suicidality, and also violence at home. And that they have nowhere to go to. And through the chat, which is anonymous, you hear the most dramatic issues. So I'm really asking hereby also to the audience to participate also with families, because I think one of the nice things of these studies that hasn't been mentioned yet is that you as a family can participate. Large families up to 9 members. And I participated with my son, and I think it was very interesting because I had conversations with my son which I wouldn't have had when I didn't participate with the survey. Like there are questions, do you like your father and mother during homeschooling, and those kind of things. And so it really stimulates also to have a proper discussion at home. So that was very nice. And alcohol and drug use has been mentioned already, but I was also, I'm also interested to see if there is an increase in internet use or smartphone use or gaming. And I guess that will be the case. But I'm curious whether this will lead also in more addictive behaviors of gaming at the long run. So I hope in the future, yeah, we'll hear some results on that. So yes, and the loneliness issue, and I know Marco, you've done some research also on loneliness. I find that really intriguing because that has surfaced across the whole society. Even our king in the Netherlands mentions it. Our prime minister now in his weekly speeches mentioned it. So the mental health and the loneliness, I think maybe one of the good things of this pandemic that mental health, and this is on the agenda more across the globe, I guess, but at least in the Netherlands. And I think, yeah, if that's definitely something positive that came out, because in the Netherlands we had yesterday again a tough speech with increasing measures that are taken with starting tonight actually, and that our prime minister really mentioned, actually for the first time I heard him saying that really that mental health and looking after each other is one of the advices he's giving. You know, normally it's about economy and bets and money, and you know, it really made us also appreciate him more. And so yes, although dramatic, I think there are some good things that come out of this. One more remark I would like to give on what Christoph was mentioning, why we would see older people, that they are used to being alone. I think another thing is that older people might be used to deal with setbacks in life. You know, some of the older people, they've survived wars, they've lost loved ones, they've dealt with so many setbacks that they're maybe more resilient. And for young people, a lot of them, they haven't really experienced a setback. You know, this is the first time in their life that something happens to them. For some of them at least. So yeah, so I'm really happy to be part of this fantastic study. And yes, I will continue also to make efforts to disseminate through, at least in my country, and to get more young people and families included. And I saw already a question coming, but I was also wondering if there are already some trends between nationalities or continents, maybe, if you can say anything about that already, or if that's too early yet.
Since I have to leave in a couple of minutes, maybe I can just respond directly to what you said. So we don't have yet compared really countries directly or continents. We see clearly that people spend more time on the internet and social media, but at least the people we were able to survey in adults have not talked so much about gaming as a compensation. But again, we haven't had many children and adolescents. Out of the 107,000 people, only 2,500 are children and adolescents. So we really need all of you to participate with your kids, with your friends' kids and families in order to increase that number. It's a little cumbersome. You need to go on as an adult and then click that you give consent for your adolescent or your child to participate. Then you're asked 2 questions about your child or adolescent, and then you pass on to them. If they're adolescent, they can do it alone, but with younger children, it might actually be really fascinating to do it together.
Yeah, yeah.
But
I think that's one of the hurdles maybe why it's difficult to get the children, because you cannot disseminate it in the school class because the parents are not there. Eh? And
yes.
so they need to be at home with their parents to give the consent. Eh? That's maybe what's slowing down it a bit.
Yeah. And then the final point that you made, I want to underscore, I think the pandemic gives us an opportunity to destigmatize mental illness. We're all in the same boat. We're all experiencing a major environmental stressor that puts all of us at risk of not only worsening pre-existing things, but developing problems. And I've talked to people who answered the question with one resiliency question, which is like, how easy is it is easy for me to bounce back from difficult times. And some have told me, you know what? I answered it a different way in the beginning than I would answer it now. So although we think resilience is a trait, it can be eroded and undermined and become a state. And here again, I think making steps outside, making steps inside, but making steps towards other people, this is, I think, very important, but also steps in the environment and in our cultures to destigmatize mental illness, to seek help when things are bad. Even now, where we now have telemedicine, we can still provide care. Even you don't have to come into a clinic, but that we make sure that people recognize their own mental health problems, recognize it in their friends and loved ones, and seek help that they can have. So I have to unfortunately wave off, but thank you so much for the opportunity to talk to you. I would have loved to continue, but have another great half hour and then hopefully a good discussion with the audience. And again, please participate, www.COH-FIT, C-O-H-F-I-T, COH-FIT.com. Take care. Bye. Stay healthy.
Cheers.
Cheers.
That puts all the pressure on you, Marco. Are you ready?
No, but
if I know, Teresa, you already sort of read Timothy's question, and just for the sake of posterity, I think I'm just going to read it out loud. If it's the Timothy that I think it is. Anyway, Timothy, maybe anticipating a bit here, but have you identified some trends along nationality lines? If so, do you think that culture may play a role on how our mental health is impacted by events such as a global pandemic and the measures it brings? So I guess Professor Correll already said, you know, that you haven't done any comparative analysis yet, but the issue of culture, right? So does the culture, and sort of, for me, it's easy to say, maybe it's related to sort of the gender impacts that you've talked about, but can you at least, if not give any correlation or causation, at least venture an unscientific guess as to the role of culture and the role it plays on mental health in times of pandemic?
So in terms of cultures, I think we will be able to make some inferences. I mean, I think it's very different to measure culture as a construct with a online survey focused on other things. But I think that since we are actually collecting the language that people use to answer, and also the country where they are living, and also the country where they were born, we might kind of make some inferences about at least the migrant status, or whether, I don't know, where people were born, and also if like at the age at which way they came to the country where they were living now. So we will be able to look into this, but I have no data, as you already anticipated on this. What I think is that more than the culture, the problem will be the integration of the person with the culture of the country where he or she is living. Of course, if a person is not well integrated, it means that he or she will have a poor social network and connections and people that can help him or her not so well as it could be for other people that are, on the other hand, well integrated and well networked with other peers. So I think it's more, it's more owing to a minority in the sense of a non-integrated minority within a country rather than any specific culture that might play a role actually on how people deal with the pandemic.
Thank you. I don't want to sabotage my time or abuse my role as a moderator, so I want to give the floor to the other speakers if there's an issue that they wanted to follow up on.
Yeah, I can also share one good news that just came to my mind. Christoph was mentioning that people realized and discovered that they could deal with the pandemic in a different way compared with what they were doing or they might have been able to do at the beginning. So this means two things. The first one is that, of course, resilience might be kind of affected by the pandemic. I might not be able to do so well after some months of the pandemic as I was able to do at the beginning. But it could also mean the opposite, the other way around, so that people might have learned how to deal with bad situations and they might have become aware of resources and coping strategies they might have not even be aware of before the pandemic. So this is one thing. And the other thing, but this is just like a kind of optimism and attitude and an interpretation, but I also have some data, and these are very, very relevant. So we took a look at the pro-social activities. So we asked people, how many times did you do pro-social activities in the last 2 weeks, and what about the last 2 weeks before the pandemic started? And the pro-social activities were very simple things like going to the supermarket for other people that could not get out of home, or homeschooling kids of other families, or I don't know, bringing food or also clothes or money to people that maybe have lost a job or were struggling for other reasons. And we found that in all the strata of the society, these pro-social activities increased. So this is also kind of a sign that the population might have felt more part of a unique whole thing and a whole community. And in this way, the sense of altruism and helping out each other might have been higher than what it was before. I think this is relevant, and it also shows the humanity that we all have, and that even if during regular times we might not witness these behaviors so much, when it's needed we are still able to do it.
Yeah, I think that that's a really important point, certainly in the UK, and a little bit what I've heard from the World Health Organization. People have been talking about fatigue. So the idea is that we need to be worried about the lockdown because people will become fatigued. The counter argument, which is closer to what you've just said, is that actually human beings are well motivated to work as a community, to support each other, to do what's right, where if we get clear instructions and a clear purpose, then we're prepared to work together in order to maintain the health of our neighbours. And that fits in with what you were saying, that the dangerous situation here is when we're given confusing messages or contradictory messages, where people in positions of leadership are not following the rules themselves. Then people get confused and get upset. And I think that that's one of the reasons why the findings of anger might be so relevant, because this isn't depression or hopelessness or frustration even, in terms of upset at ourselves or what's going on, anxiety and depression. This might be anger because we would like to do the right thing and we would like to hope that we and our neighbors are getting through this. But if our leaders are undermining us, we are angry at the situation. So I think the idea that there is a great deal of community spirit, that people are prepared to do the right thing, but we're angry when we're let down by poor leadership, makes a lot of sense in this data.
Yeah, indeed. And what we are also envisioning to do when we will start analyzing the data is also run like a network analysis, which means that you consider all the variables, all the psychology or behavioral constructs that we collect as nodes of a bigger network, and all these nodes will be connected by edges, and the strength of the nodes will be measured according to how much it is connected with the other nodes. And I would not be surprised if anger will play a major role in, in keeping together all the other psychopathology constructs and symptoms.
Yes, and one of the things that I would be very interested in, so a few years ago I did a little study where we were looking at just a cross-sectional study looking at general stresses in people's lives, whether that's historical abuses and violations of their rights, or whether it's was social deprivation. And of course, what I was interested in is those psychological processes that mediate the impact of negative life events on people's distress. So we had adaptive coping was a mediating process, a psychological mediating process that mediated between social deprivation and well-being scores. So normally, the lower your social status, the lower your socioeconomic opportunities, the lower your well-being. But that was strongly moderated by people's adaptive coping skills. And similarly, negative life events impacted on anxiety and depression, but that was mediated by the degree to which people ruminated over the experiences that they had. So here, there's a great deal of opportunity to think about this major set of stressors, the virus, the potential physical impact of the virus, the lockdown, the economic consequences, and then to think about which psychological mediators protect us against the impact of those social determinants. And there's huge potential in this sort of analysis, I think.
Yes, I think this will be a nice problem to have. We will have so many data and so many possible ways to analyze them. Of course, we will have to stick to some a priori approaches, because otherwise you end up, kind of fishing and combining outcomes with exposure, and then you make a lot of confusion at the end of it. So we will stick to some a priori hypotheses, and those that you mentioned are of course among the a priori hypotheses. We are working now on a design paper, and we will of course invite all the people that are part of the COH-FIT family, let's say, including Therese, to contribute and to seal the design paper that will then be used as a priori concept of future analysis. But I agree that mediation, moderation is the way to go, and we will most likely combine a priori hypothesis-driven approaches together with data-driven approaches and with kind of machine learning or other approaches to see, for instance, what are the predictors of the co-primary outcomes that we have, which are well-being measured with the WHO-5 and the psychopathology composite score.
I know some of the conversation got a little bit technical there, and for a lawyer, I'm barely keeping up. I want to sort of give the space to Misha, because I think you had something you wanted to add, or nope? Okay.
Not specifically.
Yeah.
Did I make a sign?
Oh, sorry. Therese, did you, I know you might not be able to stick around. Is there any input that you want to give before we take another side question?
No, I'm very excited about this first kind of kickoff with a broad discussion, open discussion with the general public, and to hear some of the first results. I think it's a great way, you know. Of course, the papers are coming out, which are technical and are, you know, accessible for a selected public. But I think, as Marco and Christoph said, this is a broad study that is inclusive. Then I think also sharing the results should be inclusive. And that's why I think this is a very good initiative to discuss and share this with, well, whoever wants to attend, basically. And I think this is something that could be repeated in the future at another occasion, maybe. Yeah.
I want to sort of ride on those coattails.
Yeah, maybe I can say something which is of course close to my heart, is that we are talking about collective trauma. And I also hope that we can focus on what are the factors that increase resilience, and is there actually in the end a positive effect? Does trauma lead to resilience, and does trauma and resilience also lead to a purpose in life, some community collective purpose? So that would be the grounds common factor for me, which I'm very interested in.
I think, if I may, I want to sort of read a quote that was not from the COVID survey itself, but from something internal that we've kind of collected at the university. It's a first-year student at at our university, and it's anonymous, so it's he, she, or they. But it states that, I feel like because of Corona, I have absolutely no social life. I cannot interact with anybody. Classes are online, and I feel lonely. I really don't feel the quote-unquote student life at all. And I think this is just one person's opinion and what they are experiencing, but I think it really resonates with a lot of other students. And so far, we've given some coping mechanisms, but if you were on the receiving end of this concern, this feeling, the sharing of this raw emotion from a student, there's a part of me that would sort of be reluctant to say, well, according to the 5 ways of well-being, you should exercise and you should, and I think these are all important things, but I think there is, I get this sense that there is something that's missing by just operationalizing and valorizing this research. I can't get this feeling out of my system that these prescriptions, these interventions, these measures, it seems like it's missing this human touch. Am I the only person that feels that, or is it just, if I can ask someone to sort of...
We're talking about interventions that has to be in a human relationship with acknowledging feelings and feeling feelings and validating feelings. That's what's compassion all about. So and normalizing feelings of anger, feelings of sadness, feelings of loneliness. I think when you can share, when we are as a society share our common vulnerability, our common humanity, we'll have more a higher level of wellness. Because it's also isolating if you think you are ill because you have these feelings, or if you think that you're the only one because everybody's going on with his life happily on social media. So I think that's the first step, being open about all these feelings and thoughts we're suffering from. And that's a part of being human, that's not a part of being ill, and that we can share it. And I think that will help people actually before they have to do something. to feel better.
Yeah, I think that's.
I don't know what my colleagues think about that.
I agree, and I think the idea that this is a collective and global trauma rather than an individual trauma is important. And I think that the response to individuals has to involve something about what we are doing and how we are suffering, rather than what you're doing and what you're suffering and what you need to do to respond to this. So I think use of the word "we" is probably vitally important.
Yeah.
At this point, if we can sort of start gradually moving towards the winding down, I want to sort of give a short space for each of the remaining speakers with a parting word or parting advice or a parting thought for the remaining audience members. And if I could start with Therese, I know you have to leave. I don't mean to put you on the spot.
No, but thank you. No, I do have to leave. So I hereby say also thank you very much for organizing this and inviting me. And I would advise everybody to, to do physical activity and enjoy the nature and also complete the survey and the social contact aspect advice. I think the two advices that Marco and Christoph give, I think they may sound very like trivial, but I think they're invaluable and the most crucial ones. And so with that, I say goodbye and I hope to see you next time at the next event.
Thank you again, Therese.
Bye-bye.
I can have Marco continue on.
Yes, thank you. So again, I think exercising, just walking outside, exercising within our home, reducing sedentary behavior are all useful strategies. If we try to team up with other people, even via social network, kind of engaging context, who is going to run faster or who is going to walk more, even if remaining at home, can also add a bit of fun in this coping strategy, which of course helps. And it's also very, very important to reach out if, despite the coping strategies, any of us would feel they need help from a doctor or from a psychologist. There's nothing strange about it. We are everybody struggling during this period, so please reach out. The other does not only COVID. The health systems are still working. They still provide healthcare for all the other conditions. So if you are affected by a chronic condition, or if you feel strange that you're doing not so well and it's something strange new is happening to you, please reach out. We are all here to help you, and the health system is not stopping to provide care for other conditions. And take the survey, of course, www.coffee.com.
Thank you, Marco. Peter, before we get to you, I just want to include one commentary from one of the audience members by the name of Brum. And he writes that as a GP, I see patients cannot verbalize the feeling COVID gives them. So maybe it's pre-verbals, right? So I think it might relate to the culture aspect too. In some cultures, I suppose men are very bad at speaking about feelings. As one of my least favorite question my therapist asks me is, how are you feeling? And I don't have the words to answer that. So how would your survey sort of take into account these pre-verbal, these difficulties that people might have vocalizing their emotions? Is there any way you account for that? And if I could just kind of have Marco sort of touch upon that before we're getting back to Peter, if that's.
Well, we are also asking about how people are feeling regarding their physical health. So we have all, I would say, rough proxies of feeling bad on the physical side and also on the mental side. We don't have too specific questions on whether people were feeling heart, like heart beating, or I don't know, or sweating more, or other physical symptoms, possibly of anxiety. We don't have that granularity because we opted to go larger and wider in terms of spectra of symptoms assessed, rather than diving too deep into just one symptomatic dimension. But yes, I think we will be able to account for how people are feeling in terms of physical and general health, and also loneliness plus anger plus stress. Also, stress is a word that is, I think, is not so stigmatized. It can be used by anyone. It can be understood by anyone. So if you see someone in your office that is not doing apparently so well, but he or she is struggling to communicate how he or she is feeling, you might ask, how stressful do you feel right now? And it could be a starting point to then dive a little bit deeper into how this person is feeling. This could be a starting point to create a contact and a bridge between you and the patients that you see.
Thank you, Mark. I hope that addresses Bram's concerns. Moving on to Peter for closing thoughts, comments.
Well, I mean, two thoughts. First of all, this sort of research is wonderful, as we've said, and it can give us enormous insights. I think the other thing is that all of the comments that my colleagues have made about things that we can do to help, I simply agree. That they've been wise and sensible comments. I guess there's two things that I would particularly stress. The first is the idea that this is very much a collective stress for people. So I think always thinking about this in terms of, like I say, in terms of the word we rather than you or I. And I just think that one of the other things is, especially now, we should try to ask people in our ordinary everyday interactions a little bit about how they're doing, how they're coping with the situation, how they're feeling, whether there's anything we can do to help, and just a little bit more than normal reach out and offer a bit of a compassionate voice to our neighbours. I think human beings are pretty good at that. Right now, we need to do it just a little bit more, I think. And, you know, it's lovely when people ask you how you're feeling. It's nice to get that little verbal stroke. So I think collectivise everything and make sure that you inject a bit of compassion into your day-to-day interactions.
That's beautiful. Thank you. Misha, if I can pass it on to you.
Yeah, I think I'm agreeing with Peter. I think not everybody feels that they're not feeling well, but not everybody is aware about common suffering and the common stress. And I think what we need to do, because we're physically more separated, is calming ourselves down, because we're also stressed. So we can become aware of the fight-flight response and be the first one to stop the fighting thing. That's the primary reaction you also see on social media. People are stressed, and the stress leads to denying of things or anger towards people, politicians. You see the polarization, separation. The first thing you can do is to become calm yourself and be present with other people's suffering. And before you do something or say something, you can just be with other people. And that's physically more difficult now. But you can also reach out by the internet, by telephone. You can give some stroke by verbal strokes by telephone. So people, the loneliness is a cause close to my heart, and I think that's a more deeper suffering people experience. So we have to put more energy in reaching out and connecting, especially if you're doing quite well. So it's a collective problem, and we all can influence ourselves, but we can also help the people surrounding us. That would be my last remark.
Thank you. My 2 cents would be that I am very grateful of the study. I know some scientists might have issues with methodology and whatnot, but it's such an inclusive effort. 31 languages, 147 countries. You're giving voice to people who otherwise might not feel like their voice matters. And I think as a side benefit, that's a beautiful thing. So I'm speaking of compassion, that's giving voice to people who otherwise might not feel like they have a say. And I appreciate the way you've designed this research. In wrapping up, I think some of the takeaways, coping mechanisms, tangibly speaking, would, to summarize, pro-social activities. Again, it can't be stated enough, but be compassionate to your neighbors, those in need around you, even if it's just ordering pizza for somebody, just to pick them up, just a nice compliment. That might be something that could not only help them, but help you and your mental health. Take steps, or as Christoph said, take step towards others, which is related to the first point. Call your family, talk to them, maybe use the COH-FIT survey. You might find out whether your kids actually like you or not. Let's keep talking to them. And maybe the COH-FIT survey would be a way to sort of facilitate that conversation, ask questions to people that you love and care about, but never thought about asking personally. Calm yourself, but also expect and demand more from your policymakers. I think this was the point that Peter made earlier. I think there are certain parts of the world where leadership has failed us, and I think it's okay for us as citizens to demand better. And this is the last point that I think it touches upon the question that Timothy raised, a second question about resilience. And I think collective trauma, as we've mentioned, does lead towards resilience. I guess history is indicative of that. Those who've survived wars, world wars, 2 of them, 3 of them, have come away stronger, the older generation. But the question that Timothy raised was, well, at what point does resilience grow? Can you tell the difference between the first wave and the second wave? Have we increased our resilience? I don't know if you'll find the time for the answer, but perhaps that could be an interesting avenue of approach, because if through this collective trauma, we have grown stronger, especially for the youth who have actually, this is the first real traumatic event, then maybe measuring how our resilience has grown would be a very positive takeaway for the research. So with that, I would also like to send a shout out to my wife for taking care of the baby upstairs. Again, confirming some of the insights that you found, but also thank you to the organizers. Thank you for Misha, Jaime, and then Remy, who's also the technical whiz behind the back. We hope the audience members have gotten something out of this. I sure have. And wish you a safe and a wonderful remainder of the pandemic. And with that, I'm signing off. Thank you very much, everyone, for participating. I'll see you on the other side.
Thank you.
Let's stay contacted.
Thank you. Bye-bye.